20 years of addiction and overdose sending him to hospital and a 6-week wait for a recovery center. But now 38-year-old Tyler Strachan calls Last Door Recovery Society his home as he continues to recover.
It started with alcohol and smoking pot, and then after not too long I was doing cocaine.
And he's one of the lucky few that made the 6 to 8 week wait list to get in for help.
Thank you.
So that's good.
Yeah.
Giuseppe Ganci with Last Door Recovery says while they serve around 80 people at a time, many just can't get in.
Our wait list is so long that sometimes you can't even get on our wait list. Before COVID, there was opportunities, if everything was aligned properly, that you could get a bed rather quickly here within 1 or 2 days.
He says he wants to see health officials and the province put more money into recovery sites outside of downtown Vancouver.
Addiction seems to always start in the burbs. I mean, for me, it started in the burbs. I came from a Catholic family in the burbs.
We feel safer going home and using than going to use in a safe site, let alone going downtown Vancouver to use it. There's more potential for hazard there.
On Saturday morning, 5 people were found unconscious from an overdose inside a Surrey home. After several doses of naloxone, they were revived.
This was in a nicer neighborhood, so it really just goes to show that anyone can be a victim of overdosing.
Ganci says this reality of drugs in the suburbs adds pressure to an already exploding issue.
We don't just have an overdose crisis, we have an addiction crisis in this province. And what is your recovery plan?
BC's provincial health officer says more efforts are being made to focus in on where many of the overdoses are happening, in people's homes.
Work that we've been doing to support people in recovery, to support people who are using drugs in accessing safe supply, and making sure that we can support people when they're at that place where recovery is an option, and that is ongoing despite the pandemic.
Both Ganci and Strachan want more resources put in the suburbs, with hopes that'll bring awareness to the growing concern outside of the downtown core and cut back on wait times. Zara Premji, CBC News, Vancouver.